Dear colleagues, it's a pleasure to be here at the Oncology Update Conference in Delhi, India. My name is Bedke. I'm from Stuttgart, Germany, at the Eva Meyer Steel Cancer Center. So we have a lot of evolving landscape in the GU field. And if we start with renal cell carcinoma and the latest developments, we know that the pembrolizumab has been approved as an adjuvant therapy based on the DFS advantage and the significant overall survival advantage, leading to a strong recommendation by the EAU guidelines to be used. On the other hand, we also know that subsequent IO therapy on patients progressing under pembro or in a short time frame under pembro may be questionable based on the results of CONTACT-03 and TiNivo. Well, for the adjuvant setting, a lot of is moving, and they have new trials like SPARK22 using belzutifan and pembrolizumab. The trial has finished recruitment. In the adjuvant setting, one new development, which I personally find very, very interesting, is a personalized mRNA vaccination approach. So what is being done? You use paraffin tissue, do an NGS and neoepitope detection against which a personalized mRNA vaccine is produced. Recently, with the E94004 trial finished recruitment with this mRNA approach in combination with pembrolizumab compared to pembro alone. Other trials of mRNA vaccination are on the way in the adjuvant setting of kidney carcinoma. Well, for the metastatic setting of RCC, the landscape has been settled of the TKI and IO combination. So I think we can move on a little bit to bladder carcinoma and what is happening. Here we have the new EV and enfortumab vedotin pembrolizumab combination, EV being an antibody-drug conjugate being linked to the Nectin-4 as the antibody part, releasing the monomethyl auristatin as a payload to the tumor cells. And the EV302 trial, which was released at the ESMO meeting 2023 and recently approved here in India, is one of the new combinations in the first-line metastatic setting. We know that the PFS and the overall survival is nearly doubled if compared to the GemCis or the GemCarbo as the comparator in this first-line setting. We will have a long-term update being presented at the ASCO meeting, probably with deeper analysis of responses in regard to PFS, data of the long-term update which has been presented at ASCO GU meeting this year. But don't forget, EV Pembro is a new combination. We also have the perioperative setting. The perioperative setting where you use GemCis plus a checkpoint inhibition. And the Niagara trial using GemCis plus durvalumab is a new combination, improving disease-free survival, improving pathological response. And I think as they are now moving with new combinations in the field of the first-line setting to the perioperative space, there's more out there. We have other trials like KEYNOTE-866 of GemCis, pembrolizumab in the perioperative setting, KEYNOTE-B15, KEYNOTE-905, but also the Volga trial using EV Pembro as a combination, EV Durva as a combination. So this is what has happened, and the future will be bright here in this setting. So I wish you all a very success at this conference. Thanks so much for listening.